Hello, my name is Charlene Obona. I am an SWK 285 at Grand Canyon University, and my professor is Dr. Miranda Taylor. I will be diving into some ways that a therapy session should be conducted by the practitioner. The process of conducting therapy session. Identifying the need for therapy. 93% of practitioners serve clients with mental health issues. Practitioners are able to identify mental health concerns. Therapy is a practical way in addressing mental health issues. Therapy will entail the severity of the client's mental health. First, a practitioner should be able to identify the need for therapy. A survey conducted by the National Association of Social Workers reported that 93% of social workers serve clients with mental health issues. Mental health issues are the leading cause of depression, intrusive thoughts, suicide ideation, and social interactions. Social workers play a vital role in identifying, assessing, and treating mental health concerns. A practical way to address mental health issues is through therapy. Social workers can gather a better understanding of the client's issues by engaging with the client during a one-on-one therapy session. Preparing for therapy. Practitioners should gather essential tools for note-taking. Practitioners should also gather information on client prior to the meeting. Referral forms are essential as other resources may be helpful to the client. Preparing for therapy is important before beginning the actual meeting with the client. Obtaining important information regarding your client, such as their race, age, gender, what values they have prior to the meeting. What are some other approaches practitioners should take before actually meeting with their client? Collecting supplies such as notebook for note-taking can also be helpful in ensuring that the issues and goals of the client are remembered. Practitioners should also obtain referral forms based on the client need for therapy, as other resources may be found helpful to the client. Preparing for therapy. What challenges has the client faced? Are there any highlighted concerns that the practitioner should be aware of? What are the goals of the client in meeting? Preparation for therapy also involves understanding the challenges and goals of the client. I wanted to elaborate on this further, as mental health issues is our focus today for the client, and better understanding how mental health is affecting the client is paramount in understanding how to approach the client issues before the meeting. For example, information such as knowing if the client has attempted harm to self, others, or has the mental health issues caused client to withdraw from physical care can help practitioners with an idea of the client before the actual meeting. In addition to understanding the goal of the client, the goal of the meeting, and the idea of how long the meeting should last. Conduct therapy. Practitioners should ask how client wants to be greeted upon first meet. Making eye contact with the client is essential. It develops warmth between practitioner and client. Practitioners should be aware of the diversity in client to help with positive development. Upon meeting with the client, the practitioner should greet the client by asking how the client wants to be addressed. Mr., Mrs., or just first name shows the practitioner is respectful to the client and how they want to be addressed. Making eye contact and being aware of the tone in your voice can make a difference with the first impression. In most situations, the first meeting can be awkward for the client. Understanding the gaps in diversity can help practitioners navigate with the client so that collaborative, interactive relationships can develop. Conduct therapy. Practitioners should provide a purpose to the client for the reason for the meeting. Explaining the process of the meeting will give the client a better understanding of your purpose. Practitioners should be clear in the approach that they will take. Consent form should be presented on day 1 of the therapy. Fully explaining the process of the therapy meeting will put the client at ease as they begin to understand your purpose as their practitioner and their rights as a client. For example, practitioners should say things like, "The purpose of this meeting is to identify some of the mental health issues you face that are difficult to deal with so that we can find various ways to get you feeling better." Practitioners should exhibit this action first so that there is a full understanding from the client. Furthermore, a consent form should be explained to the client, the confidentiality between the two of them, unless there is an imminent threat to self-harm or others. In addition to asking the client if they have any questions or concerns, allows the client to address any issues prior to the meeting. Creating assessments. Assessments are essential during the first meet of therapy. It focuses on the need, strengths, and challenges of the client. Client information may be sensitive to them. Practitioners are to be empathetic to the client's issues. When social workers conduct therapy, an assessment is created that focuses on the client's needs, strengths, and challenges. Assessment should entail the client's personal life and those who surround them, such as family, friends, supporters, and non-supporters. This process allows social workers to gather sensitive information regarding the client's life and those who surround it to better understand how the client life is affected. In addition, assessment should bring clarity to the social worker, as questions should be open-ended so that the client can elaborate on their issues further. Demonstrating active listening to the client. Practitioners' body language should be congruent to what the client is saying during the meeting. Nonverbal and verbal active listening is vital during the therapy session. Both skills show respect and empathy for the client need. Active listening is demonstrated by the practitioner in various ways that shows the client that you are sensitive to the issues that are being said. In active listening, the practitioner not only gives their undivided attention to the client, but the practitioner must be seen to be listening with nonverbal and verbal signs or messages. Practitioners Body language should be slightly leaned forward towards the client in a way that shows concern and empathy for what the client is saying. Focusing on listening to what the client is saying will allow the practitioner to gather the tone in the client's voice, speed of delivery, and style of speaking. Furthermore, this is also a great time for the practitioner to express warmth and empathy through their demeanor. Active listening, reflecting content, and reflecting feelings. Social workers demonstrate active listening through various ways. Reflecting content is demonstrated by reiterating what the client has said. Reflecting feelings is demonstrated with precise intuition and empathy to the client issues. Social workers can approach therapy meetings with their clients through reflecting of content and reflecting feelings. Reflecting content is exhibited where the practitioner reflects on the perception of the client's reality. Clients begin to understand that the social workers are portraying active listening by confirming what the client has said. Examples of reflecting content will be: client: I have tried to make my friendship work, but I don't feel like I need to. Social worker: if I am understanding correctly, you feel it's best to end the friendship. Furthermore, reflecting feelings has more of an empathetic approach that allows the social worker to use intuition to guess what the client is feeling. Examples of reflecting feelings would be: client: I start a goal and can't ever seem to complete any of it. Social worker: it sounds like it frustrates you when goals aren't completed. Both examples are strategically demonstrated during active listening to client. Competence in social work practice. Practitioners are knowledgeable on the client and their need for therapy. Practitioners should exhibit new knowledge through evidence-based practice. Practitioners deliver therapy, treatment, and provided services based off their knowledge of their profession. Practitioners should develop competence in the work that they provide to the client during therapy sessions. They develop understanding of the needs of the client through research and attending courses that is focused in the areas of competence that enhance their professional expertise. When practitioners conduct therapy, they apply evidence-based practice as a guide to deliver treatment and services based on the client's preferences, culture, race, and ethical values. In addition, practitioners aspire to contribute to the knowledge of their client while conducting therapy and to the knowledge of their profession. Follow-up. All therapy sessions have to come to an end. Practitioners relate these messages respectfully. Practitioners are sensitive to the diversity of clients when ending a session. Clients should take time to reflect on new discussions for the next meeting. Clients should leave therapy sessions feeling hopeful. Termination of therapy is implemented when client has reached their goal or stopped responding to the practitioner. Practitioners should be aware of the therapy session end time. Strategizing ways to let your clients know that the session will be ending soon is an important part in therapy. Practitioners that are sensitive to the diversity of their client develop ways to relate these messages with regards to not coming off rude. An example of ending a meeting would be, "We've touched on some important things today. Will you like to schedule a meeting for next week?" This allows the client to have something to look forward to and a time to process more goals or challenges that they are faced with. Practitioners follow up with their clients to ensure that they are on track with the plan of action and to prevent hopelessness. In contrast, practitioners should determine termination of therapy if the client has reached their goal or if the client has stopped responding to a practitioner. That is the end of this meeting, and thank you for listening.